Hi, all. Thanks so much for joining us on the very first Speaking of Making Healthcare Work for You recap session. I'm Stephanie Fields, and I am joined by Dr. Apurv Gupta, who is my co host for this series. And Apurv and I just finished our interview with Mike Critelli, who is the co founder of the Make Us Well Network. And Mike shared a lot of really amazing insights about COVID-19 and the hospitalizations. And he talked a lot about nursing homes and everything from crowded living conditions to ventilation. So, Apoorv, what really stood out to you about that interview we did with Mike?
Yeah, that was so fascinating, Stephanie. I think it's amazing as our launching pad for making healthcare work for you. Mike, I thought there's so many topics you can cover in COVID, and a lot of our audience has probably heard many of them. So to some extent, there's a little bit of information overload, and people start tuning things out. To me, what really struck out is the depth at which he's really understood what's going on in the nursing homes. You mentioned a couple of the points, which even our audience can take home and keep in mind if they have someone that's going into a nursing home. Look at the density of the patients in the nursing home. The smaller facilities may be better. Try to get a single room if possible. That's a great tip for people to keep in mind. Something as simple as ventilation. Now they may not be enough data about it, is what he said, but we as individuals can certainly ask when we're looking at a nursing home, what is the ventilation like? And he also talked about something like about checking humidity. Now that may also be more complicated, but I think his key messaging there was, in addition to expecting the regulators to come up with fixes and demanding the data, we as individuals can just be more vociferous advocates for our own healthcare and ask about each of these variables. So for me, that was a great take-home message, and actually learned a lot from that. What did you make of it?
I agree. The nursing home information was really fascinating, especially because he talked about the disparity in, first of all, data collection, but also in the differences of the results that they've had. And he said that
Mhm.
some nursing homes are actually doing really well, which you're certainly not hearing on the news. But what you are hearing about is the ones that are doing really poorly. And so I love that he shared the information about things that you can do or things to look into. And in full disclosure, I think the a lot of the summary of our conversation with him is that a lot of this does take time and a lot of process overhaul, but there are things you can do in the meantime to try to make your situation better, which I loved. And I'm really excited to share this full interview with people. I think it's going to be great. And I think they're going to learn a lot. I know I did.
You're going to love it. Yes. Thank you, Stephanie. Great collaboration. I'm very excited about kicking this off with you today.
Me too. So thank you all for watching and stay tuned for the full interview with Mike Critelli from the Make Us Well Network. We'll talk to you soon. Bye.
Bye bye.